All right, good morning. My name is Marissa. I'm going to be your nurse practitioner today.
Morning.
What's your name?
My name's Ted.
Hi, Ted. Nice to meet you.
Nice to meet you.
How old are you?
I'm 43.
Okay, wonderful. And what brings you in today?
I've been having some pain in my right knee for a little while now.
Okay, when did that start?
It's been about maybe 6 weeks, maybe almost 2 months now.
Oh, really?
Mm-hmm.
Okay.
It's been a little while.
Has it progressively gotten worse or kind of?
It's been getting steadily worse.
Okay,
That's why I came in today.
Worse enough to bring you into
Yes.
the clinic today. Okay, wonderful. And it's only on your right knee, or does it radiate anywhere?
It's pretty much just right around the knee.
Okay,
yeah,
just
but
kind of
everywhere else matches.
all encompassing
Kind of the whole knee, yeah.
Okay. And can you describe the pain that you're feeling or the discomfort that you're feeling?
It's kind of like an ache, just kind of throbbing
Okay.
sometimes.
Okay. And is it worse with doing activities or?
It's definitely worse when I get up, try to walk on it, if I'm
Okay.
trying to run.
Okay.
It's pretty bad.
Mhm.
Yeah.
And is it relieved by anything? Have you tried any medications? Like
I've been trying some, yeah, I've been taking some leave.
Okay.
That seems to help some.
Mhm.
Resting it definitely helps. If I stay off it for a little while, the pain starts to subside quite a bit.
Okay. Have you tried elevating it or icing it or
I
anything
have. I've
like
been
that?
popping it up on the couch. I've been icing it occasionally.
Okay. And does that help just a little bit
Yeah.
until you use it again, basically?
Yeah.
Okay.
Yeah.
All right. And so you said it's pretty throbbing.
Mhm.
So is it continuous throughout the day, or does it start maybe when you wake up in the morning, or
As the day gets on, it starts to get worse, and then by
Okay.
the evening when I go home and rested, then it kind
Then
of
it
starts getting
gets
a little
better.
better again. But yeah, it's definitely worse during the day, I would say.
Okay. And what kind of started this pain for you? What were you doing about 6 or 8 weeks ago that
I
got this
just had started running again,
Okay.
trying to get in a little better shape, losing a little weight.
Sure.
And at first it didn't seem so bad, but then, like I said, about 6, 8 weeks ago,
Yeah.
I started kind of slowly noticing this throb, this ache in the knee, and it's just been
Mhm.
getting worse.
Okay. So you were starting to work out a little bit, wanted to get back into getting a little healthier. And how many miles do you run? Do you run pretty
About
long distance?
2 to 3.
Okay. So probably by the end of it, you're starting to feel a little bit more throbby.
Definitely.
Okay. And how would you rate your pain on a scale of 1 to 10? 1 being the, not so much pain, to 10 being the worst pain you've ever felt?
About a 4 or 5 out of 10.
Okay. And that's kind of when it's at its worst?
Yeah.
Okay. And have you had any fevers or night sweats lately? Any, other than exercise-related weight loss, any unexplained weight loss?
No, haven't been sick at all. I've lost some weight, but that's been kind of gradual,
Mhm.
what I've been planning on with exercising again. Nothing
Okay.
significant recently or anything.
Okay. Have you been changing your diet habits as well? And that probably contributes
Eating a little healthier,
Yeah.
but no real huge changes in my diet.
Okay. How much weight do you think you've lost in the last 8 weeks?
About maybe 4 or 5 pounds.
Okay, that seems pretty normal. And any other symptoms that you've been feeling? Any dizziness or anything when you're utilizing your knee?
No, just the pain of that area, nothing really
Just the
else.
pain.
Yeah.
Okay. Well, have you been taking any other medications other than the Aleve? Any regular medications?
No, I don't normally. I take a multivitamin every day.
Okay.
But that's really the only other thing I take.
Okay.
I have been using like a little muscle rub on the area,
Like a-
like a biofreeze kind of a thing.
Okay.
It's supposed to just kind of numb it a little bit.
Yeah.
It doesn't really work very well.
Doesn't help.
But, yeah.
Okay. Any relevant medical history? Any history of other orthopedic injuries or?
I broke my left wrist when I was 17
Okay.
from a fall. Didn't need surgery or anything for it, though. I was just in a cast for about 2 months.
Okay.
Other than that, no medical problems, no surgeries, anything.
Okay. No hypertension or anything like that?
No.
Anything in your family? Any arthritis in your family or?
Yes, arthritis on both sides of my family. My grandparents, my parents have not. No, I take it back. My mom has some arthritis.
Okay.
My dad has high blood pressure, high cholesterol.
Okay.
And then my maternal grandmother had a stroke at age 83.
Okay. So a little bit of arthritis.
And
in the
then
family.
my maternal grandfather also died of a heart attack at age 67.
Okay. So a little bit of cardiovascular disease and some
On both,
arthritis.
on both sides.
Both
It's just
pretty-
that, my maternal grandfather died from that, but my
Okay.
maternal grandfather did not.
Okay.
So.
All right. Any social history? Are you a smoker?
Mm-mm.
Drink alcohol?
Rarely.
Just rarely. Okay. Any depression or anxiety recently with this change and starting
I
the
wouldn't
weight
say
loss?
so.
No.
No.
Okay. Great. Any allergies for you?
Just seasonal allergies. I
Okay.
don't have any medication allergies or anything.
Okay. Great. Well, I'm just, also you said surgical history, just the wrist, you did not have to have
I didn't have to have
on it?
surgery, no, and I've had no other
No other
surgeries at all,
surgeries?
no.
Okay,
Yeah,
great.
no.
I didn't do a physical assessment just to try to see if we can figure out what's going on with your knee.
Okay.
I'll have you start by standing up. I'm going to
Okay.
inspect your knees and check for symmetry.
Okay.
You just face me.
Mhm.
Perfect. All right, the knees look symmetrical. There's no inversion or eversion of the knees or knock knee or bow-leggedness. I'm going to check from the sides. I think it looks good from the back. Perfect. And as you're bearing weight, do you feel any extra pain, or is it just still that same
Pretty much just the
consistent-
same level, yeah.
Okay, just kind of a consistent throbbing pain.
Mhm.
Okay. You can go ahead and sit down for
Okay.
me. We're going to test, going to do some palpation. So I'm going to start with your unaffected knee, so your left knee, and I'm going to palpate your patellar bone and your tibial tuberosity and the fibular head. Any pain or
Mm-mm.
tenderness? Okay. I'm going to palpate the popliteal fossa. Any pain or tenderness?
Mm-mm.
Okay. I'm going to move to your affected knee. Just let me know if there's any pain or tenderness when
Okay.
I palpate. Also palpating fibular head, the tibial tuberosity, and the patella, as well as the popliteal fossa. Okay, perfect. Now we're going to test your range of motion. So
Okay.
if you can go ahead and extend your left leg.
Okay.
Okay, perfect. And extend your right leg. Perfect. And then go ahead and lay down for me.
Okay.
We're going to test your flexion. So go ahead and bend your knee and flex your knee. Perfect. Any pain or anything?
Uh-uh.
Perfect. You can go ahead and let that one down. Now go ahead and flex your knee if you can. If it doesn't cause you too much pain.
Just kind of the same level it's been at.
Just a little bit of tenderness.
Yeah, just a little tender or sore.
Okay, perfect. You can go ahead and let that down.
Okay.
And I'm noticing just a little bit of swelling since it is kind of the end of the day. You haven't been able to elevate it or
Right.
ice it or anything like that. Okay, perfect. All right, now I'm going to test your strength by doing the varus and valgus test. And that's going to test the strength of your tendons to see if there's any sort of meniscal tear. So
Okay.
I'm going to start with your unaffected knee over here. And I'm going to go ahead and have you flex your knee. And the varus test is going to be adduction. So I'm going to be flexing your knee and putting some counter pressure, pushing your knee inward.
Okay.
Any tenderness or pain?
No.
Okay, perfect. And then the valgus test, I'm going to pull it towards me. Any tenderness, pain? Perfect. All right. I'm going to go ahead and do that on your affected knee. And again, let me know if there's any pain or tension.
Okay.
I'm going to go ahead and flex your knee. And I'm going to adduct it. So that is the varus test. And I'm going to abduct it, which is the valgus test. Any pain or
Not any more than what I already have.
okay. And any numbness or tingling in any of these tests that I've done so far?
No.
No? Okay, so no neurological deficits so far. I'm also going to do what's called the anterior and posterior drawer test. So that's going to also test your PCL and your ACL tendons. So I'm going to sit on your leg here. I'm going to kind of pull your tendon towards me, okay? Any pain? Okay. That's the anterior drawer test. And the posterior, I'm going to push inward. Any pain?
No.
No? Okay, wonderful. So the anterior test is testing for your ACL and the posterior is for your PCL.
Okay.
So we're going to try it on this side. So again, pulling towards me for the anterior. Any pain or anything?
No.
No? Pushing towards you for the PCL.
Mm-mm.
Any pain?
No.
No? Okay, perfect. All right. And one more thing we like to do is test for what's called the auto and knee rule to see if we need to do an x-ray or anything like that for any fractures or things or sprains. There's just a few rules with that I like to go over. The first one is your age. Since you are under the age of 55, then that is a 0 point for that. And then when I palpated your patella, do you have any other pain outside on your fibular head or your tibial tuberosity? Any other pain on any of the bones related to your affected knee?
No, just kind of feels like you're just like in the joint,
Mhm.
kind of very really. So
Okay, perfect. And then when you bared weight on it, you said you didn't have any extra pain or any, you were able to walk. You were
yeah,
able to-
yeah, I've been
bear
able to
weight.
walk. It's just sore.
Okay, perfect. So that'll be a negative test for the Ottawa knee test. So that makes me think that it is not indicated to have a X-ray. So based on that, what I was kind of looking at with my 3 differentials were a potential meniscal tear. And after the test that we did on your tendons, it does not look like there is any sort of meniscal tear based on your lack of pain response, lack of swelling, or tenderness related to the tendons. So I'm not thinking that anymore. Tendinitis would also be one of my differentials based on you starting to work out and using your tendons a lot, but again, not looking like there's any inflammation or warmth when I was palpating your joints. And so what I'm thinking of is potentially rheumatoid arthritis with your strong family history of arthritis, usually starting out with a unilateral, just one-sided knee. So we'll keep an eye on that left knee and see if there's any other arthritis in that knee or in any other part of the body. We'll just keep a close eye on you.
Okay.
Do you have any questions?
No, I don't think so.
Okay, wonderful. Well, thank you so much.